Involves a cervical, parotid, submandibular, and supraclavicular lymph nodes, less commonly axillary and inguinal. Clinical features: it's initially a firm subcutaneous nodule fixed to the overlying skin, followed by a cold abscess formation, followed by secondary ulcerations and a sinus tract formation. Ulcer has undermined edges and penetrative floors. So here's your photographs. Scrofuloderma shows ulceration and separation of underlying lymphadenopathy. Then scrofuloderma shows a cervical lymphadenopathy with ulceration and scarring, axillary lymphadenopathy with discharging sinuses. Course: numerous sinus tracts and fistulae develop over a period of several months. Spontaneous healing may occur with pucker and cord-like scars. Scar tracts characteristically blister areas of ulceration or even normal skin. Then bridging scars result due to suppression and healing with fibrosis occurring in matrix tuberculous lymph nodes. The Deficient diagnosis is atypical mycobacterial infection, lymphogranuloma venereum, actinomycosis, porotrichosis, acne combinata, hidradenitis suppurativa, orificial tuberculosis. It's a rare form of tuberculosis of the mucous membranes and skin adjoining the orifices, presents as a nodule which ulcerates with undermined edges. Site affected depends on the site of internal tuberculosis. Pulmonary tuberculosis affects the mouth. Tuberculosis of pharynx involves the larynx and lips. Intestinal tuberculosis involves the ana, perianal, and external genitalia. Genetic urinary tuberculosis in women affects the vulva. Prognosis is poor due to advanced internal disease and compromised immunity. Acute miliary tuberculosis of the skin. Rare manifestation of fulminating tuberculosis due to membranous dissemination of mycobacteria into the skin from a meningeal or pulmonary focus. Tops are numerous, minute elements of bluish micros, papules, vesicles, pustules, or purple lesions occur on all parts of the body, especially the trunk. Usually occurs in infants, young children, or immunosuppressed patients post-resistant HIV infection and measles. Tuberculous gamma is a humidified dissemination of mycobacteria from a primary tuberculous focus during periods of lowered resistance. Commonly involves the trunk, extremities, or head. Lesions arise as a single or multiple pronged subcutaneous nodule or fluctuant abscesses. Ulcers with undermined edges, sinuses, and fistulae may occur. Healing occurs with cord-like and pocket scarring. Tuberculitis occurs as a hypersensitivity reaction to M. tuberculosis or its products in patients with moderate to high immunity following heterogeneous spread of mycobacteria. Salient features: positive tuberculin test, evidence of obvious or past tuberculosis, a positive response to anti-tuberculosis therapy. Tuberculitis types are mycopapillary, which includes lichen scrofulosum, papillary, which includes papillomatrix tuberculosis, and nodular includes erythema induratum basum and erythema nodosum. So here are the tuberculitis. Lichen scrofulosum includes a skin-colored group perifocal papules, papillomatrix tuberculosis healing with variable scarring, and erythema induratum. Erythema is indurated plaques on legs. Erythema induratum basum, also known as nodular tuberculosis, is a chronic recurrent nodular and ulcerative disorder. Commonly affects young or middle-aged obese women. Men affected occasionally. Predominantly affects calves, may also occur in the upper thighs, buttocks, and trunk. The nodules on an indolent course and form ulcers. Ulcers are ragged, irregular, and shallow with bluish edge. Diagnosis: absolute diagnosis is established by a positive culture of M. tuberculosis from the lesion, identification of mycobacterial DNA by polymerase chain reaction. Other diagnostic criteria is suggested by clinical history and physical signs, positive reaction to tuberculin test, demonstration of tubercle granuloma, and histopathology, demonstration of acid-fast-fascinating deletion, presence of culture proven active tuberculosis focus elsewhere in the body, effect of specific therapy. Mantoux test here shows the erythema, induration, and bulla formation. Histopathology: the tubercular granuloma and epidermis in the case of lupus vulgaris. Classical Langerhans signs are seen. Continuous tuberculosis treatment, general principles, notification, identification, and treatment of the underlying tuberculosis focus, identification and treatment of coexisting infections such as HIV, specific chemotherapy, and ancillary measures. Drug regimen, standard regimen comprises initial intensive phase 1 and continuation phase. Drug therapy is 6 months regimen for adults. Rifampicin 450 mg per kg or per 450 mg or 600 mg weight less or more than 50 kgs for 6 months. Isoniazid 300 mg daily for 6 months. And pyrazinamide for first 2 months. 1.5 gram daily for patient weighing less than 50 kgs and 2 grams daily for patient weighing more than 50 kilograms. Thiamidol for the first 2 months. Dose 15 mg per kg for body weight daily. Revised National Tuberculosis Control Program. One culture positive specimen from extrapulmonary site or histological evidence or strong clinical evidence consistent with active extrapulmonary TB. Rate कैसे हुए? कोई बात नहीं. TB category 3 sputum smear negative, category 2 sputum smear positive. Here are the following regimens: 2 HRZ3 plus 4 HRZ3. In regimen 2 is HRZ3 plus 1 HRZ3 and 5 HRE. So here the photographs showing pre-treatment and post-treatment. Special considerations of treatment are surgical intervention coupled with AKT and Scrofuloderma, small lesions of lupus vulgaris, tuberculosis, varicose cutis. Plastic surgery in cases of disfigurement due to lupus vulgaris. Standard regimens effective in HIV positive. HIV infected individuals, higher drug reaction and infection rates. These are photographs. Identify. Rahul, thank you.